It is 11:34. My name is Colleen Reyes. I'm the chair for the Drug and Alcohol Commission. I want to make sure that I emphasize that we thank you for your time. And we're going to go ahead and do roll call at this time.
Marina Medina.
Earl Medina.
Carlos Montemayor. Armando Duarte.
Jesse Hernandez.
Margarita Garza.
Aria Martinez.
Michelle Saldaña. Esmeralda Redondo. Adriana Morales.
Jaime Pérez.
Erica López.
Nancy Sebastian.
Valeria Beltrán Huerta.
Julie Clayton, Puerto Rico.
Nancy Cadena Huerta. Sandra Reyes.
Juanita Sebastian.
Diana Solis, Laredo Crime Stoppers. And then we have Miss Angie over in the back.
Angie from
Thank you. We're gonna go ahead and move to an invocation, which Earl Medina is going to, go ahead and give. At this time, just because of personal reasons, if you choose to, do the invocation, you're welcome to. If you don't, then refrain from participating.
Let's take a moment to bow our heads. Heavenly Father, giver of life and health, comfort and relieve those challenges by serious and chronic mental and emotional illness. Give your power of healings to those who minister your needs, and they may be strengthened in their weaknesses and have confidence in their loving care through Jesus Christ, your name. Amen.
Amen.
And the reason we are emphasizing that is going to come in a little bit, so, we'll take a vote to see if you're okay with it. If you're okay with it, we'll continue to do it. If you're not okay with it, we'll go ahead and consider that. Public comments, anything for public comments?
No comment.
Thank you. Right now, if you'd like to review the approval of minutes for April 9th, they are in the, the commission members' packets. Please review them, and I would like a first and a second.
A motion to approve.
I have a first by Margarita. I have a second by Marina. All in favor, say aye.
Aye.
Any opposed? Say nay. Motion passes to approve the minutes as written for April 9, 2025. I know that we continue to get guests. If you'd like to, for the record, mention your name, please. For anybody who's not mentioned.
Frank Allen Guzman.
Lexa Calewitz.
Thank you. Thank you for joining us. Ma'am, can I please have you introduce yourself? Your name for the record?
Veronica Hernandez from Puerto Region Behavioral Health Center, Community Health Worker, Substance Use Disorder.
Thank you very much for joining us. We're gonna go ahead and, at this time, obviously mention for the invocation, is everybody okay with doing like a quick little prayer invocation at the beginning of our meeting? Can I get a raise of hands? It's not an official, but I just kinda wanna get an idea. If you do not want to do an invocation for religious purposes, can I see a show of hands and it's okay too? Okay, we're gonna go ahead and continue to put our invocation in our agenda. At this time, we are going to go ahead and move forward with the administrator's report, for Dr. Richard Chamberlain, Dr. Luis Serra.
Dr. Silva is out today, so I'm gonna do a super quick, report on information he wanted me to provide. We did update for April the vending machine for, our Narcan distribution. So the one here at Laredo Public Health for April, we had 17, Cigarroa 10, and Baskin 10. So it was a slight decrease, we noticed in the month of April. Again, just a reminder, we do have the GIS map where you can track pretty much the hotspots around the city, whether it comes to what substances are being used when or found in overdoses. And here we have the comparisons of the last 4 months in 2025 compared to 2024. As we can see, there has been a great decrease in 2025. The only month was February. January, for instance, 2024, we had 7 overdose deaths, and then in 2025, we had 1. February, we had 1 in 2024, 3 in 2025. So far, in March, we had 0 this month, 4 in 2024, 6 in April 2024, and 0 in 2025. So we have seen the trend where it is decreasing. We want to say that it is probably a community effort where we have done all these harm reduction strategies as a community in Laredo.
Erica, will you go back to the GIS?
Yes.
And then what are we looking at, what's in purple?
This purple
Yeah.
is overdose with pills in 2025.
And then the second is a yellow, right, cocaine?
This one, or,
Yeah.
this one's unknown.
No, the mustard ones.
Oh, the mustard is cocaine.
Okay, so those are the. Okay,
So when you go to the website, you can filter all these, you can layer it out however you.
and it's on the public health.
Yeah. it's
Okay,
on our
perfect. Great information, I
I
think
clicked on it quickly just so you guys can see what the website is.
the efforts are definitely working.
See, you can zoom in, it categorizes it by age as well, and you can go back to 2024 and 2023.
Good information. As a matter of fact, yesterday I was at, the sheriff's award ceremony, and they, awarded the DEA task force for, overdose and fentanyl awareness. And, this may, I don't know if those numbers are shared, but, they are shared? Okay, that is, I wanted to kind of, the next month we'll have a presentation by them, but I kind of wanted to make sure that we collaborate with them so that they get that information. But good information. Does anybody have any questions regarding the report? If not, I think congratulations are in order. Mental Health Awareness Month is going on, and I saw Erica, you got awarded something. What was that?
No, I spoke at the proclamation, and I was like, I did, no. I was like, no,
I was like,
I'm all like, what is that? No, I spoke at the proclamation for mental health proclamation.
Okay. And there's a lot of stuff going on within the city. Do you want to share maybe some of the efforts, for mental health awareness?
Well, here with Laredo Public Health, we do have 3 mental health programs. We do have the Juntos for Better Health, which is our community mental health grant. They do focus on individuals with depression and anxiety, but they do provide a lot of free classes to the community, whether it comes in forms of therapeutic art, types of meditation and stuff like that, so you can find that information mostly on our social media. Then we do also have our LETS program, which does provide counseling to individuals living with an STD, STI, and they provide testing, follow-up, and treatment. And then us, my program with the Assisted Outpatient Treatment Program, we do provide court-ordered outpatient treatment for individuals living with a serious mental illness, such as major depressive disorder, schizophrenia, and bipolar disorder. And we do offer psychiatric care, we do medication monitoring, counseling, home visits out in the community, and we do follow up with them pretty frequently during the week to try to reduce those crisis occurrences. So those are some of the efforts that we do provide with public health, yes.
Those services are freelance, right?
Yes.
Do you have a waiting list?
With AOT, we do not. I'm not quite sure about Juntos and LETS program.
How about the mental health?
All 3 of them provide mental health services. So for Juntos for Better Health and LETS, I don't know if there's a waiting list. For AOT, there's not a waiting list. It just goes through the court process instead of court appointed.
I can say for the very first one that you mentioned, I make a lot of referrals to that program. I know the counselors there, they're very good counselors. And I've never had a problem waiting lists, you know, there's a lot of people that call me that don't have the resources, so, you know, it's a very good service for anyone who has mental health issues that do not have capacity for a place. So congratulations on that.
Yeah, they do provide counseling and psych as
They
well.
do, yes.
What's the phone number?
For AOT, it's 956-679-0722. And let me see if I can do this.
And this information is found on the Laredo Public Health.
Yeah, everything.
So I think if, the website, please. Jaime?
LaredoPublicHealth.com.
Perfect, thank you so much. Any other questions before we move forward with the next report? Thank you so much for that, and thank you so much for all the efforts that you all, commit to doing with the city and with this, commission. We appreciate you all, truly.
I do have one more thing.
Yes.
Our pet lovers, pet parents, animal care is now under the public health umbrella, and with that, we are creating a mental health sort of activity / curriculum over there. So we're implementing mental health days, not only for us, for the community, but for dogs as well. So those that have been in captivity there seeking adoption, we implemented once a month to go out to parks and invite the elderly. Last month, we partnered up with Webb County's, community, the community center out over there by Pita Mangana. I'm sorry, I forget the name. But their elderly community went out there and participated in it, and it was a good turnout, and we wanna keep inviting it and keep that going, because the mental health component through our pets is also very, very important. Not just for us, like I say, but for the dog seeking for adoption.
You had, also for cats as well?
Yeah, for cats as well.
Because I had a veteran that's been seeking for placement for his 2 cats.
Yeah.
He has them indoors due to find a placement, or else he's gonna be evicted. So, do I have him contact?
After the meeting, we can connect, and I can connect you with the right person for that.
Best friends for
Why don't
life.
you get a letter?
Right, best friends for life?
Well, Animal Care it's different from Best Friends, but we're implementing, things for that.
Yeah.
Yes, Mr. Eddie, so go ahead and reach out to Jaime
Yes.
right after.
Thank you.
But thank you so much for that information, I think that's wonderful. I have 3 fur babies too, so I think it's very important. They keep us sane, and we have to make sure that they stay sane as well. Thank you for that. We're gonna go ahead and move on to detox facility update report, Dr. Viviana Martinez.
Yes, she wasn't able to make it today, so I'm gonna be filling in for her. For those of y'all who don't know, we're Roots Recovery Center. We are a detoxification center here in Laredo. We work with withdrawal management, counseling services for people who have substance use disorders, as well as crisis stabilization. They can be self-referred, by jail or hospital diversion programs. They can come in self-paid, or if they don't have any insurance, we're not going to deny them services. Everyone is pretty much welcome. As far as reports, since October, we've had 232 admissions.
Since when, I'm sorry?
Since October of last year.
I just want to comment that congratulations, and to the first draft that you made, this comment to Margarita, we just submitted the manual report, the SAM stuff, and one of the comments I made was about the drugs and overdose, and the commitment that you all of us have in making sure that there's a drop in overdoses. I mentioned the points to the Roots Recovery Center with overdose going down, the Narcan efforts. So there's we see the drop in our SAMHSA program, and congratulations to all of you that have done this work to make sure that our overdose deaths go down, because it's been a dramatic rise. Congratulations to you and everybody else.
Thank you for the report. Is there any other questions or concerns regarding Roots Recovery? If not, I'd like to request next meeting if you can bring the brochures and have these out just for reference, and that way all our stakeholders are welcome to bring in their informational material and place it on one of the tables, and if needed, if we have new guests or anybody who is unfamiliar with the services, they're able to get that information available from your agency. Thank you. We're gonna go ahead and move on to discussion and possible action. Consideration of a custom drug and alcohol commission outreach t-shirt for use during educational and community events. I want to bring up discussion to include review of proposed design, potential vendors, cost sharing by members and or agencies, and assignment of a committee representative to coordinate orders and collect shirt sizes upon committee approval. And so I think we've discussed in the past, the possibility of getting out to do more activities and more outreach events, but we're all out there doing within our own agencies. So I think it would be a great representation to either wear a shirt while we're doing our activities for our agency, and or perhaps maybe something that signifies that we're representing the Drug and Alcohol Commission. I've seen it, ask me about this, or, the 988 buttons and stuff like that. So I wanted to consider creating something that brands the Drug and Alcohol Commission. We're one Laredo Crime Department participates in a lot of events, and a lot of people come up to us and ask ask us about, obviously, how to report the drug, in the community. So with that, we obviously have an issue of other things, that may be, sent to all the other agencies. And so, I think it would be a good idea to have a representation of the Drug and Alcohol Commission and start making the community more aware that there are resources to help our community. And so I wanted to kind of make, quick discussion and see what you all thought about that, and, see if, it would be something that each agency or as an individual representing the Drug and Alcohol Commission as a stakeholder to expend perhaps a shirt. I know Ms. Nancy, way back when we had initially started, we did an activity over at the mall, we did a little video event, and they went to each booth and got a stamp, and then were able to get, multiple door prizes from that event. And I think we had a shirt at that time, but ask me where that shirt is, it's probably somewhere. But I think it's time, I think we're very strong right now, it's to show our unity, and our representation of the commitment that we have with the Drug and Alcohol Commission as stakeholders and members, is that maybe we should consider doing like a t-shirt, nothing fancy, just to go as far as a polo, but, I think something that is easy, affordable, and, something where we create a design on it. So your thoughts?
I'll be happy to do it again.
How much were those shirts, más o menos?
Back then, I think we paid about $10, maybe 12,
Okay.
but I can get us quotes.
And you have vendors, different vendors. Okay. But then if everybody's okay, maybe Ms. Nancy, we ask for quotes. I wanted to get Jaime's feedback, considering his role here with public health, to see if maybe you can help us with the design of a shirt.
Yeah, we just need to decide.
Idea.
Decide on the idea, and if we're gonna just implement the logo, or what exactly y'all want us to do.
Yeah, I think for sure the logo, I think you took the time and everybody voted on the logo, so I think the logo should be on there. But maybe something with a action or something that prompts somebody to ask something. So maybe think of something, right? If everybody's okay, can we start discussion and say, yes, we're gonna go ahead and consider it and make it our own cost? Yes, no? Discussion?
Would it be mandatory everybody has to purchase one, or those who
No,
are interested?
whoever's interested is interested in representing. I mean, obviously, some of you all have to go back to your agencies and say, you've been sending me to these meetings every month, but is it okay when we go out and given the opportunity to come and wear this shirt? Whenever you all have the availability to do so.
We're looking at a photo or a t-shirt.
Option.
I mean, if it's for events and stuff, I'd recommend a t-shirt, and then something to show our unity. I know the logo is DAC, but the logo doesn't really symbolize that stand, what county, city of Laredo, everybody's here. So something in the back that showcases that it's all the city working for you guys. Then we can put something together and show it to you guys.
Let's do two options and see, do you have a vendor, like, do you have options for vendors?
I call different vendors and get the best pricing.
Okay. All right, so anybody else wanting to share any information? Other than that, can I have a motion to move on this, item that the committee will take? Okay. I have a first by Nancy, do I have a second?
Second.
I have a second, by Jesse. All in favor, say aye.
Aye.
Any opposed, say nay. Motion passes to, do a custom design for polo and shirt, and then have the commission members consider and stakeholders, for their own cost. Thank you so much for that. We're gonna go ahead and move on. We're gonna do a follow-up on committee meeting frequency requirements in response to, recent communication regarding quarterly meetings. I think, at the last meeting and meetings before, we have discussed the attendance, and I think the city's getting a little bit stricter on, how often we, can let go of our commission members with regards to their attendance. Ms. Angie printed out the attendance form. They are being very strict, that if we do not attend, what was that, 3 meetings consecutively, then you are no longer a commission member. We are required to meet on a monthly basis unless we, agree to bring it up to the city secretary, and upon their discretion, they can go ahead and say it changes. But as of right now, all the commissions for the city of Laredo are required, to meet on a monthly basis. And so, last time we talked about whether, morning, we meet in the afternoon, we meet during lunch. So we're being very mindful about the time, lunchtime, so right now we're trying to aim for 12:30 to be out. That way you all get back to work, but nonetheless, I just wanted to make sure that you all are aware that the city does require that we meet once a month unless otherwise authorized by the city manager. As of right now, we do have a good group, and as a matter of fact, just want to congratulate Ms. Yvette. She was officially appointed on 4/7, and she will be representing, Dr. Tyler King, Ms. Yvette Ortiz. Welcome to the Drug and Alcohol, Commission. And then I do have, regarding the city, and I'm gonna go ahead and put it in there, is that we all got a memorandum, from the city of Laredo on April 16th. Ms. Angie sent it out to all the members of city boards, committees, and commissions, and the subject was expression of personal views on city matters. I'm gonna go ahead and read it really quickly, but just the first, okay. So the dear members, the purpose of the memorandum is to remind you of the importance of maintaining the distinction between your official roles and personal opinions when discussing the city of Laredo matters publicly. All of our meetings are recorded. Again, please be mindful of what you are saying or how you are representing. For more information, this memorandum is available with Ms. Angie and or by email. If y'all have any questions, you're more than welcome to ask at the end of the meeting, but just so that you're all aware of that. Are there any questions or any comments?
I do. I have a question. When we have discussed attendance and participation, I think there was an option of us being able to log on remotely. Is that still an option?
I believe that the
Not
city.
all the time, but at least, we're out of town or something where we have that
Yeah.
option to be able.
Because I was looking at my attendance, right, and January is always going to be the month that I miss, but I'm trying my hardest because we obviously need to be here. But some of our members are more absent than not. So then there has to be when can you log in, and how many times can you log in, and how many times are you not
Exactly,
here?
yeah.
So
So
I think
they
it-
have one or two options to log in online.
The only thing there is if you log in online
Mhm.
or through a WebEx, you're not considered quorum.
Correct.
You have to be in person to be considered quorum.
And that's
what they
fine,
mentioned.
I can attend most of the meetings, but every now and then if I'm out of town or anything, but at least it doesn't affect attendance. I'd hate to see a member leave because they're not able to attend in person.
Well, I know that the members that are considered, on their attendance is that they've lacked more than just the 3. I think they've gone for as far as 7 meetings, and we have 12 months. So that's more than the attendance that we have. So those are the ones that are being considered. There are no exceptions at this time, but they are, the thing is that if you do 3 consecutive, so try to stay away from 3 consecutive, or no miento, it was
3
throughout the year,
total.
yes, never mind. I'm talking about my bylaws, that is correct. So it is 3 in the whole year, so I do apologize for that. So again, to reiterate, it is 3 in the whole year for you to be, considered out of the commission.
I just wanna mention, I was here in March, they put me out.
Okay, so make sure, with that, make sure that you all sign in. I know Ms. Angie had to improvise today, but make sure that you all sign in, whether you're a guest or you are a commission member or stakeholder. Please make sure that you always sign in at the front, that way we don't, miss that.
Can we correct Jesse's?
The X actually is when he was present, the, zeros did not attend.
Yes, but I attended in March.
Yeah, he did.
Yeah, but he's there, it says that he did attend.
Yeah, I'm
There's an
saying
X.
that's a mistake. I attended,
Oh,
I didn't attend in April because I had a crisis, but I
So-
attended in March.
Technically here,
Yeah.
she's saying the
Yeah.
O's, the zeros,
Present.
the reds are did not attend. It does mark you with an X, if you were
attended.
present.
Yes,
So X is present.
X is,
yes,
X
exactly.
is present,
Yeah, the,
Oh.
what's the red is you not attending.
I'm.
And I believe, and I believe, Earl did send out the dates, so for you all to plan ahead and mark your calendars and just be, aware that.
I know it's a tough conversation, but I know that it is what we've been talking about and it's required. We are supposed to meet on a monthly basis. to, in order for us to meet quorum. Is
So
there
if we
any,
meet, if we miss 3 times, we're automatically out, or we're gonna be informed you're no longer?
what was that that it's automatically out? I don't think that they are giving you a courtesy to tell you that you are.
your
Yes.
receipt.
So then am I out? I missed 3 meetings.
It takes into effect in January 2025, because when did we have that advisory meeting? It was at the beginning of January, and I think I missed it because it was middle of the whole season. So,
So, yeah, I just want us to
So
all be
did it
very
start
clear.
after that meeting?
I won't be here next month for next month's meeting. I will be in Florida.
Mhm.
And last month I was running behind because I was in a meeting after pre-agenda and I couldn't get out.
so the discussion has been made before, and we can make it, we can open it up to say, decide. If we meet afternoon, if we meet during lunch, if we meet in the morning, there's been discussion about that. The majority of the people had, I think, felt comfortable because we've had the most attendance at this time.
Yeah.
Unfortunately, some of our stakeholders are not able to, and we brought that up for discussion. So we'll note it, we'll put it on record, but I don't know, I don't have those answers. I'm just going based off of what the
Yeah.
city is stating. Because there are no, from what I know, is there is no excusable reason for the attendance. We all have work.
For me, it's not a problem at the time. Until in January, I had back problems, and so I did attend. And then I can let you know that I see cases back to back. And so sometimes I have crisis that takes me over, like last month, I had a client who was suicidal. And so I'm not gonna leave that to the state.
I understand, and we all have,
Yeah,
I mean,
I'm just saying.
and everybody's, and respectfully, in everybody's job and career, I think we all have some form of emergency crisis or personal,
Right.
situation that I don't know how to remedy it. So we'll bring it up to the city and see if there's anything that's excusable, or if there is a way to come back with the exception of you not missing anymore from now until then. But really and truly, I think we've discussed the option of going online and the fact that we can't meet, quorum if we're not present.
We'll
So I
look
do
into more
apologize for that.
thoroughly about what happens after the third absence and, how far of like excuses and stuff, but from my understanding, they are very strict when this new memorandum came about. But we can be more thorough about it in the next meeting, we can definitely give you, an update.
Yes,
on the-
please, I think everybody has questions, and obviously we would like answers. I can tell you, there are other commissions, I think, for the most part, last year we did meet some of our meetings, but there are some meetings, there are some commissions within the city of Laredo that don't meet quorum. And so, when we come back to, we're taxpayers, and we want our city to be represented, we are all appointed by a city council member or commissioner from Webb County. And so, our responsibility is to be here, understanding obviously that there is other things that may come up. We wanna make sure that we meet quorum and that there is discussion for some of these topics.
Is there a way to maybe consider representation on behalf of if we're unable to make it?
And I was about to say, previously years, and I think Miss Nancy was the one that used that, that substitute. Whenever she was not here, she would send a representative from her office. I don't know how, that gets a little tricky, because it's you who is being appointed, not the agency.
It would come down to them not being able to vote, so it'd be the same thing.
Okay, all right, so then that's, because we used to have it, and I know Nancy would be the one to set somebody in her place to still take notes and represent her, but I do know that it's us who are getting
Right.
appointed, so it gets a little tricky, I don't know. I don't have those answers, it's up for discussion, because we wanted to talk about the frequency, because we said, do we meet and make it mandatory and put it up to the city that says, we meet every quarter, but at that, you cannot miss that meeting, and, because we would meet 4 times out of the year. But they've said we
Gotta be
can't.
one thing.
So,
Do we have flexibility, for example, we meet Wednesdays, right? Today's Wednesday? Yes, okay. If most of us have conflict to meet, can we move it to like Friday? Would that still
I
count?
mean, you can
as-
send out emails before and get a grasp of the attendance.
I'm just throwing
I
options out
don't,
there
I don't
too.
think it's going to fly, I'm gonna be real honest with you, when people have already gotten the dates planned out, for it to be moved on a, well, let's just say on a whim, you know, let's change it now, because 3 people can't attend.
Like for next month, most of us will know if we're out of town, if we have something, and we can't make it to the meeting. I don't know, I'm just trying to.
So, any modifications would have to be at the city council level?
Yeah.
Okay,
Well, at
and
the
then that's
city,
where we have to go?
at the city secretary level.
Okay.
Yeah.
So, you know, for example, in January, I was getting steroid injections. What would, if somebody, I mean, there may be people that are sick that actually have excuses, valid excuses.
Well, that's what we said, we
Yeah.
understand everybody's reasons, and so we don't know at what
Maybe
point,
you could look
how
into
many
that.
personal
Yeah.
excuses you can get, or how many work excuses you can get. Again, we probably have to revisit and say, we won't do it during lunchtime, we have to do it after hours or early in the morning, and that's an upward option. So I think these are questions that we're jotting down, and we'll hopefully get an answer, pretty soon. I know that I had brought up that question before, and Ms. Angie got that, answered really quickly by the city secretary. So just again, be mindful of the attendance. If you have any more comments or concerns, please feel free to discuss it right after the meeting before we exit. We're gonna go ahead and move on. I wanted to propose a development and launch a summer awareness campaign talking about, you know, people being out of town or getting busy. I wanted to focus on youth safety and parental awareness. So while parents are still continuing to work, kids are at home. As a matter of fact, this past weekend, and I hope that Laredo Police Department Assistant Chief would have been here, or somebody representing, to discuss what may have happened over the weekend. Gun control, gun awareness, gun safety, right? Those are all things that come to mind. And with regards to students, youth, kids, our family members being at home while we're working, I think there needs to be more awareness of how to be more involved, or getting them active with different activities. So if your agencies are doing anything for the kiddos for the summer, please bring that up to us so that we can share. But I kind of wanted to propose to develop and launch a summer awareness campaign. And so I know that most of you all may have worked with youth or be parents. And so I wanted to kind of get ideas of what is actually happening during summer. What are these kids doing? What are the potential dangers, and how we can keep them safe? So I wanted to bring that up for discussion, to see if we can bring up a strategy and maybe create a PSA or a campaign that just says that we are aware that the kids are at home, but there are availability for summer programs and or resources available for parents and kids. Discussion.
I do have concerns, so always been like that. Parents, of young people, not all, right? We have a lot of good parents, that give mixed messages to kids. And so, I don't know how many times I've heard from clients, or had people that get in trouble, that they've gone to these after parties, or what they call now darties, like they did last day parties, like they did last Friday during skip day. Parents are aware, they're out swimming, they're all doing this, they're all drunk. Then, after that, they drive home drunk, and then they go to the after party that starts in the evening at a ranch. And that happens over and over again. This is, you know, I mostly see adults with problems, but I have adolescents that I work with, and all of these kids are doing that, and they're telling me, oh yeah, the parents would rather have a drink at the house so that they're safe, but then they leave after the parents are asleep and they go somewhere else. And not even that accident, that tragic accident that happened a few years ago made a difference, because they were still having parties the next week. And you know, I don't know if we have to educate the children or the adolescents. I know that Scan and Pillar and everybody else does a good job, but the parents are not held to accountability even. I mean, you know, privately, because they tell me, I know who these parents are, but I've never seen anyone arrested. And they're breaking the law. You know, we had kids die, and this has been going on for years and years and years, and this is just one of my pet peeves, even when I was, at SCAN, as a consultant, I'm bothered by parents that have this messaging. Even, think about it, there's a prom this weekend. They set it up from 6 to 11. What do you think the kids are gonna do after 11 o'clock? They're gonna go to the after party. What happened to the prom at United? They went to 2 after parties, and one of them, there was a drive-by. Parents and administrators, we have to wake up. Adults have to make these decisions. Why would you give kids mixed messages? This has been going on for years and years, and we still go around, people die, and it continues.
I think we have to do preventative measures, which we all do at one point. We're getting close to graduation and prom season's halfway done, because the school year is almost done. But I think what we need to do is focus on social hosting and underage drinking.
Yeah.
And I know that there's a law, and I was looking it up really quickly because I'm focusing it on it through Laredo Crime Stoppers. And we just recently partnered with UISD, and we created a graduation message to inform individuals that they can call Crime Stoppers if they know of a party that's going on. So we are doing that. There are civil penalties and criminal charges, and I think it's just, again, education. So I've jotted it down, and we'll go ahead and bring it up to something that we can propose to do in the next couple of months. And if anybody else has any other ideas regarding the summer, while kids may be curious, right, and there's a bar, parents have a bar in their home, kids may be curious to say, well, mom's not here, what's the harm of drinking, right? Maybe bringing that up to put it away or to put it under lock and key, an example of gun safety. So if those are ideas that you all might have, I'd like to take a motion, a first and a second, to develop a strategy to propose this and get this done in the next 4 months. And then create obviously a PSA with the help of Jaime to come in and do like a script and get us maybe perhaps wearing our shirts, and then, doing a quick message and a PSA. What I would like from this Drug and Alcohol Commission is to have the activity of bringing more awareness. Again, we're all representing our agencies and our departments in many different platforms, and so I think it's a great idea for us to continuously share.
I just think the strategy needs to include parents, because it's been going on for years.
I think, my personal opinion is that, I hear a lot of my friends that are younger that are parents compared to me, and the way I was raised, old school military, so we were taught our parents are our parents, not our friends. Friends we make outside the house, and I think this is where the confusion is going on, where the parents are trying to be friends with their kids, so it's okay to drink with them or do other things with them.
But, my daughter's 39 years old. She's got her PhD. She's a social worker. When she was at San Jose as a 9th grader, end of the year party with a very well-known person in the community. They respected a lot of money. Sure, go ahead. Swimming party, go ahead. She came home drunk. We called the parents. They were there. They were there. That's ridiculous. My daughter was a 9th grader years ago. It goes on and on and on and on, and I hear it. And I've worked with people that have trauma because people have died. But the parents have to be involved in this. They have to take ownership.
Most definitely, I strongly agree. If I can have a first and a second to strategize and then have more discussion, perhaps with the subcommittee. I have a first by Jesse and a second by Yvette. All in favor say aye.
Aye.
Any opposed say nay. Motion passes to create a subcommittee to strategize on a campaign to hopefully bring more awareness and preventative measures combined through our Drug and Alcohol Commission. Thank you. Right now, we're going to go ahead and move forward. We are at 12:15, so we're going to be really quick, fast, and in a hurry to make sure that we finish up. We don't have the representative for Webb County, Mike Villarreal, or the Sheriff's Office, do we? Okay, so we do have a presentation by Scan. If you'd like to go ahead and introduce yourself and talk to us about Trinidad.
Sure. My name is Nancy Garcia. I'm the director for Trinidad Women's Recovery Home. As you can see on the screen, we are located in Rio Bravo. We are a residential site for adult females. I'm not sure if any of you are familiar with it. We are in Rio Bravo, so we're like kind of far for adult females, as I mentioned. More than anything, our facility provides a safe living environment for the women to focus on healing and learning to live a sober life. More than anything, we provide structure throughout the day, so their whole day is structured while they're at our facility. And I do believe that it helps foster values that are very important for recovery, such as accountability, empowerment, humility, independence, and many others. So our program is up to 90 days, depending on individual progress. Okay, so.
Usually when?
All right, so and I don't know if I'm going too fast, I know that we're on a time crunch, so let me know if you have any questions, okay? For a referral, what you could do is contact us. You did see our contact number at the beginning, but I'll also include it at the end. You can call us through phone or email. You could just provide the demographic information for the client, basic background about why the client is being referred to our program. You do wanna get an idea of it. We are first come, first serve, so right now we do have 2 beds available if anyone is interested. We can bring them in as soon as that same day, or sometimes, within a few days, so we do try to arrange through that. Whenever they arrive, they do go through a thorough assessment at intake, and we focus on those different areas while they're there. So the mental health, we will refer them to any of the providers, and we do a pre-screen. Physical health, we understand that, whenever they've been under the influence, they're engaging in high-risk behavior, so we link them to services. Legal situations, we have been working closely with the Laredo Municipal Court, that's only locally. So for our clients that have a lot of citations, we have been able to get them thousands of dollars removed for being at our program and completing the program. Education, right now, we have struggled with getting the Texas workforce to kind of work with us, so we have been having some struggles there, but our goal is that while they're there with us, we want to get them started to work on their GEDs. However, we do make sure that we already enroll them either at LC, the Adult College Department, or Texas Workforce to make sure that they can continue that goal while they're there. And employment, we do make sure that we help them apply for jobs. We help them create a resume, and if possible, while they're with us, we do make sure to take them to their interviews, and that way, hopefully, when they leave, they're able to already have that set in stone. And then, of course, when they show up with us, sometimes they are homeless, so while they're with us, we try to get the family involved to strengthen that relationship, and then when they leave, they can have that stable living environment. Okay, and then the last portion, the substance use component, I'll talk a little bit about it on the next slide. Services there. Okay, so we provide weekly one-on-one counseling sessions for our clients. Group counseling and psychoeducation courses or classes take place every day. So these are some of the services that we do provide provide them with. I don't know if anyone has any questions about that list. They are given random UAs while they're with us, so we want to make sure that they stay sober while they're with us. And again, because of all the structure that we have, it's very rare for them to, or we've never had any issues where they use substances, so we make sure we're really strict with that. And since most of our clients are adult females with children, we do allow children's visits each Sunday. So we want to make sure that what they're learning in their parenting courses, they're able to apply them while they're with us. Okay, and then we do provide linkages to mental health evaluations, rapid HIV and hepatitis C testing. Anything that we identify at the assessment, we make sure that we link them to those services while they're with us. We do have an amazing team there. We have a residential counselor and a case manager. So we are in constant communication with the referral party or probation officer, CPS caseworkers, and any other treaters if needed. So once they complete services with us, we do want to make sure that they safely adjust back home. So we make sure to link them to outpatient services, whether it's through our SCAN outpatient services or remind them of any upcoming mental health or physical health appointments. So
What is the capacity and what is your waiting list like?
12, right now we have 12 beds, it's 12 beds and we have 2 beds available.
Okay, and what is the waiting list like? So right now, no waiting list?
There's no waiting list.
Yeah. And just as a reminder, I still believe that the priority population still is women that have women that use IV drugs and women that have children. So there shouldn't really be a long wait, you know. So sounds like you're doing a really good job. Congratulations.
Yes, so we do have those two as our priority population, so
Yes.
those will be automatically.
Automatically. Yeah.
I wanna add, sorry, that we do also provide math services while they're in their facility.
Good.
We collaborate together,
Medical.
so if they need,
Medication.
medication assisted treatment, so, we provide Suboxone to the clients that are, struggling with opioid use disorder. And then I know, the male and the female residential also work with AMA as well, so that way they can also take the methadone while they're at the facility too. So,
Now,
Do you take both alcohol and heroin?
Priority population for them.
Yeah. I wanna, you know, because, you know, in all these years I've worked, 38 years, I've never met anyone that didn't have a co-occurring psychiatric substance disorder. But I know that you all work with Dr. René Colgan II, and I think that's a great addition. I don't know any other place that has access to a psychiatrist. And so, you know, I know because I staff a lot of cases with them. And so that's a really excellent component that you have.
we have, Dr. Copian, and then we also have, with Gloria Peroni, who work, she works at the detox center and then Health Image as well. So we have a contract with her too, so, we have options right there.
Yeah,
So,
but you have some, especially psychiatric care is a wonderful option because we only have one in-person psychiatrist in Redmond, that's good.
They also have, the peer recovery support services component added to their home for males and females. So that way when they are discharged and aftercare, they already have that support as well.
I do wanna share that, sometimes clients are using alcohol and, the opioids, and so if it's, so severe that they need detox prior to residential, they do have to go through that process first before they get admitted to rehab.
Yeah.
They have to go through detox first and then go to the residential.
Yes, so we do work with Bruce to make sure that they get admitted right after.
Any other questions or comments?
There's no wait list for the male facility too, just an FYI, they have beds available.
We also work with municipal board meetings.
The male should be,
How many beds do you have now?
16 bed facility,
For the- for the-
16 bed facility, don't quote me on how many beds are available, but I know for sure they had at least 2 available as of yesterday.
So it's 12 for women and 16 for men?
and then we also have a youth male, residential, so I don't know the.
We have 2, one in, here in Laredo by the Manganas Atalayo, and we have one in RGB in Harlingen.
How many beds are available for the youth?
I think that's,
Is that still over here by Ita Mangana?
By River Hill Loop.
No, thank you for the information, thank you Nancy for, reminding us about the recovery home and that it's available for our community. I know that some of us work for, either the court or we work with, potential clients. And so this is a form of reference if you have not used Serenia, Women's Recovery Home. Ms. Nancy's available after the meeting, to, bring any more questions or concerns, up for you all. But if there aren't any other questions, this is the time that I ask, all of our stakeholders to make mention of anything that is going on or any updates or activities that you all have.
I have a question. Yesterday we were leaving work at like 7:30, and I'm going north on 83, and we happened to see, and I'm wondering if you had seen it, cause this was new to me. It was, like a food truck, but it's called Wonka.
Oh,
And,
Yeah, I saw it on the.
and I'm like
For
thinking, I know I see some food scan, who does, tobacco compliance here, any of you?
Oh, Puerto Rican. Puerto Rican.
Your program?
Oh,
But
US
it's-
Club.
Cause I do it with, West Care, right, and I know, someone else is doing it. I'm curious, how do they get a license for a mobile,
Smoking thing.
yeah, it's
Vaping.
vaping and
Oh.
THC and, I mean, That was the first time I seen them, so that was new to me.
Is that something that, again, Jaime, or y'all can
There's-
base on?
I mean, cause they weren't too far from Cigarroa Middle School. And that's where I like, you know, thinking back when I was a teenager,
I'm
like
assuming there's some regulation because there's also like CBD shops, you know,
So there-
around town.
I'm trying to think of the right words, right?
Right.
There's regulations and they meet those regulations. There's ordinances and they meet those ordinances. If they don't, there is a 311 where we get 911s, we get complaints, or sanitarians go out there to follow those ordinances, right? But, they meet the guidelines.
But, I mean, because I was concerned because they're mobile.
Yeah.
I
It's-
think it's starting to become popular because also, near where houses, outside of it, there's also, a different truck there.
Really?
So let me give you how this works, right? Illegal food vendors, we have an ongoing issue. This is public, right? And we have an issue in a certain area of Laredo. We get a call, we show up, as soon as we show up, they leave.
Somewhere else.
It's kinda like cat and mouse, right? We go out there, we do our due diligence, and we try to enforce these things, but there's loopholes and there's things that happen. They follow regulations, they follow the ordinances. Ordinances are now, we went up from what, 2 blocks to now 4 blocks? That any smoke, establishments, smoking, they sell whatever they face, cannot be close to a school. Now, if you were already grandfathered in, say your smoke shop was already there before the ordinance, there's nothing we can do, we can't evict you from that. But moving forward, since the ordinance to now, you can be there within 4 blocks of the school.
So they have a concern with the pop-up CBD mobile, they can call 311.
311.
I will emphasize that you can also call the 727 TIPS number for Crime Stoppers, and there is a group, that is called VICE, and they will take, these calls, seriously. They will go and enforce, whatever there is. And then it's more for ordinances, so they're talking about entertainment, maquinitas, they're talking about now Botox, I think I mentioned it last time, Botox on the go. So they are focusing on, mobile services or stuff that's on Facebook or on the marketplace, so you can report it to 311 or to Crime Stoppers.
Oh, I wanted to share a little bit about some programs that I oversee with SCAN, especially the youth, because we were talking about it earlier. So I oversee outpatient youth treatment services with SCAN and for transitional youth. A lot of you all probably already know about like our state services and federal grant. We have a grant called Familias Unidas, which is with SAMHSA. With that program, we are able to have an amazing opportunity that we have weekly caregiver sessions. So I know we were talking about like targeting the parents and educating the parents and stuff. And the group has been growing. We do it every Tuesday. It's only when they're enrolled, right? So we do have a lot of other activities. I didn't share them earlier when we were talking about what to do to keep them, busy. But if you know anyone who is receiving services with us, or if you would like to refer anyone for youth treatment services, we have weekly caregiver sessions for the parent, for any caregiver actually, because sometimes it's the aunt, the grandparents, right? We have the ability to help them with transportation to get there. We have sibling care, like if they have a bunch of little ones, and I know that can be a barrier, we tell them bring them on over. We have a pretty big team that we can help out with activities for the siblings. Every last Tuesday of the month, we have what we call like a family fiesta, family event. They can bring everybody, and we do different pro-social activities. Everything is linked to an evidence-based practice. So we use evidence-based curriculums specified for youth treatment services and with caregivers. In the summer, something that we're doing is every Thursday, we have like this little satellite office that is catered for like teens. We have like a Pac-Man machine, like basketball, air hockey and stuff. So we're trying to try to keep them safe and out of trouble. On Thursdays, we're doing like kind of like a type of summer camping to treatment, to group activities. Fatherhood Effect program, which is for any father figure, or expecting father. For like support groups, or individual sessions. We have, our SMART program with SCAN, which also offers evidence-based curriculums, and activities. They've actually been working with some of the residential facilities and with the male facility. So there's, we're really integrating all of our programs at SCAN to try to provide as many services like Nancy presented. Whatever is identified in their assessment in the beginning, we try to lead them. So,
Can you send us all that information?
yes, of course, I will. Piggybacking on the Fatherhood Effect program, today we are actually gonna have an open house, and this is open to the community. You don't have to have like probation, CPS. I mean, I've had friends who like joined the program. It's just if you're a dad, you have a child 0 to 17, or are expecting, or I'm the grandpa and I'm kind of like one of the main caregivers, or I'm the uncle, stepdad, right? We're having an open house today from 5 to 7 at our Hendricks office, and it's not too far from here, 1702 Hendricks Avenue. And it's just an open house to come meet us, to come meet the facilitators. We have 3 facilitators on board that are the ones that actually do the curriculum. They're gonna be doing like a little session demonstration of what it's like, because I know sometimes it's like, I don't need that. We read and it's like, I don't have parenting issues and stuff. And it's not about having issues, it's just about how can I be there, right? It's like, I talked to my mom and she's like, well, over 30 years ago, you didn't hear about that. You didn't hear about all these things that are now, so it's ever evolving. And it's basically just to provide that safe space for dads or father figures, because we hear a lot of mommy and me, but dads, just with research, the importance of their presence in the child's development, right? And it's never ending, right? So there's that program that I did want to present, and we've been seeing a lot of success, especially with the youth in treatment that are dads that have little ones, and they're like, hey, my values, I typically have my dad in my life, and I'm the dad to this little one, but I'm struggling with substance, and I'm struggling with this. So we've really been working, we'll go see them at the schools also to do we work really close with Andes High School, with the recovery school, so yeah, I just wanted to present.
What's the address?
For the open house, it's 1702 Hendricks Avenue. And it's today from 5 to 7.
Thank you.
From 5 to
From 7.
Thank you.
Thank you for that information. Anybody else that would like to share any information? And then as a matter of fact, I think maybe next month, we would put you down as a presentation, that way you could give us, the detail and give you more time to talk about that. I think it's very important as we are getting into summer, and the whole, point of having it in the, agenda is to bring more awareness. And so I don't think that it suffices to do it within 5 minutes. I think we need to give you the time to be able to become more aware, because I've been looking around the room and everybody's shaking their heads like, this is good information, but it's not information that we're gonna retain in one time.
Yeah.
So I think it's next time, it's best if you bring up the presentation.
Real quick, I won't say too much. We did a project through Wesker, thanks to, new grant, Wesker got from HHSC to expand the development life skills, and Earl helped us. So we did 2 Ninth Grade campuses, United High School and LBJ, with development life skills, evidence-based. At LBJ, we did 380 youth, and then, at South 411, we completed the high school modules, 7 modules, life skills. And then we, collaborated with Brisk to do a kayak down the river. And you might think, well, what is kayak having to do with mental health? Well, Risk happens to have a project for heat index. And if you're not, I mean, we're already starting getting 100+ weather. So the heat index in Laredo, people don't realize that if you stay out there too long, it's gonna impact your body, your mind. And so we work together with Risk to do this project so that we can make them aware of that. And then I present on a topic having to do with alcohol to the youth before we do the project. And then we're doing involvement later on with those kids, so that we can have another session separate from the regular school to the youth in our community. So we're doing a lot of prevention and a lot of outreach. it was Western.
Well, thank you very much and congratulations on those numbers. I think those are very awesome to hear. I know that Earl took part in
Yeah.
assisting, so I think it's amazing that you're all doing a great job, so we appreciate your efforts. Anybody else that would like to mention before we close?
And just real quick, I just wanna mention, Mike's Purpose was able to give, 4 scholarships this year. 2 students from Martin and 2 students from Dixon. We don't pick the top students because we know that everybody knows that they get a lot of the funding. So we kind of go with students that have been through something and that they decided to turn their life around, so that's what we focus on. So I just wanted to say that.
All right, if there is no other comments or discussions, we are going to, close the meeting. I'm gonna ask for adjournment. Our next meeting is June 11th, 2025. Can I please have a motion to adjourn at 12:36? I have a first by Marina, do I have a second? Second by Ken?